This is a Scapulohumeral Rhythm Test. This is a test designed to assess the relationship between the shoulder blade and the glenohumeral joint. It's a really important test to do with our clients because there's quite a few possibilities in terms of outcomes that you can identify. So this is one of those tests where there's not just one corrective strategy for it. You have to actually assess a little bit deeper to figure out all the different relationships, and then the best strategy will become apparent quite quickly. To do the test, simply instruct the client to stand, if they're male, preferably with their shirt off, female in a sports bra, so you can see what's happening with their shoulder. If they're not comfortable with that, you can also palpate the test as well, but it can influence the results somewhat. It's just not the preferable strategy. From here, client bends their arms 90 degrees, and then they simply lift their arms up to the side. So the test is really simple for our clients to do. What we want to do is observe what's happening with the shoulder. So the ideal movement pattern is for the first 10 to 15 degrees in motion, there's really no movement in the scapula at all. That's called the setting phase. And most of that movement is actually done by the supraspinalis muscle, so the top rotator cuff. From about 15 degrees all the way up to 75, 80 degrees, we're going to see an upward rotation of the shoulder blade. This is good. And then when we start going above that, we'll start seeing an elevation of the shoulder blade as the upper trapezius starts to contribute to that range of motion. So some of the problems we see, the main one that we see now with most populations is the shoulder blades actually come in and together as the arms lift up to the side. So if someone lifts up, they squeeze in here, you can actually see the bulk increasing in their rhomboid muscles. This is very often a sign that they've had poor training in the past, or they've had a coach who's instructing them to squeeze their shoulder blades together at every single opportunity. What the scapula should do, as we know from the test, is it should rotate and move in conjunction with the glenohumeral joint. So this is going to cause a lot of problems for people getting pinched in their anterior shoulder when they're pressing, and then also some serious issues around here over time where people get really tight and get a lot of pain. The next most common scenario is people will elevate their shoulders immediately as they do that. So as they lift up to the side, their shoulders will shrug, and what that indicates is they overuse their upper trapezius muscles. They need to get some strengthening work through their middle and lower trapezius and the serratus anterior to help hold the scapula in position. This test can also help us identify if someone has a potential rotator cuff injury for which we need to refer out. So what happens in that scenario is when they lift their arm, they'll actually bend to the side to try and lift up. This shows that they've actually got some muscle damage there, and from there we need to immediately refer out to a doctor or a physiotherapist for diagnosis. So with each of those different results that a client has, we need to pick a different corrective approach to that. So in the one where the client is squeezing together, we're going to show you some exercises where we focus on getting the shoulder to wrap around. For the one when the client lifts up high, we're going to go through some exercises to keep the shoulders down and back. So we're going to make sure that we individualize the exercise selection to the outcome of the assessment.